if you have the conventional approach, for example, in a gastric sleeve, you are going to have 4 incisions, and in my case, I usually use the drain. And you are going to have the most bigger incision is about 1.5 centimeters. Is the incision that we use for take off the stomach. And in the case of the seals, you are going to have a small incision under your belly button. It depends on your healing, but some patients doesn't have a good cicatrization, a good healing. That patients even don't notice that kind of incision, the single incision, because it's under your belly button and is dissimulate with your curves. But it depends on each patient. Some patients make keratinized incisions, and in that case, we advise after the surgery to use a cream and make a massage. We give you all that indications before you leave the hospital, but if you have questions after, once you are over there and you're at home, we're ready we're going to keep in touch with you to give that information, but we give you that information before you leave the hospital. The advice is to make a massage after after 2 weeks of surgery, and with a special cream, and it's gonna be less the healing.
Okay. Okay, I'm going to, they've been asking about this ESG, the endoscopic sleeve. So basically, I mean, if you want to explain, basically there is a device that is like an endoscope that does the suturing, that they pass it through your mouth orally. It goes to the stomach and it folds and stitches the stomach to resemble like a gastric sleeve. But about 70% of the stomach is folded. I mean, yeah. So so it's not like cutting and removing the stomach. It's basically plication. It's like a fold.
In both, you cut and cut a percentage of the stomach, but in this moment, laparoscopic is very well studied. It's very well follow up about that, and endoscopy has a less term of studying, and it's when you make the laparoscopic surgery, you are more sure that you take off the percentage that you said. When you made endoscopic, it's a little bit different. It's not maybe the percent that you think that you are cutting, but because it's the different approach. Some patients that goes for the endoscopic procedure sometimes has to have a laparoscopic procedure after, because it's not a complete made. It depends of the endoscopist, but it's a concern about that. I in this moment I prefer the laparoscopic approach.
So they're asking, will I have saggy skin after the surgery?
Okay, yes, it's important that you have to that you know that you're going to have it, but if you follow the nutrimental instructions and the you begin with exercise early. Early, it means after the first week, you could walk and you could use the static bicycle. After maybe 1 or 2 months, you have to begin with the regular exercise. If you follow the nutrimental instructions, you are going to lose weight of your lose weight is going to be of quality, is more quality, and you are going to have less skin, less remaining skin. But if you follow that, like I told you before, the nutrimental instructions, and you begin the exercise early, it's going to be less.
So they're asking about a revision of a bypass which was done in 2009. So, I mean, probably 2009, was it maybe open surgery? I mean, you can answer that.
2009, most of surgeons made open surgery in that date, but some surgeons have the training for the laparoscopic. I think that it could be two. It could be open or laparoscopic, but it's most frequently that was open, and in that time. In this moment, even you have open surgery, we try to make a revision for the laparoscopic approach. We have to take off all the scar tissue before and after, continue with the bariatric surgery with the revision. But it's better to make a revision, to try to make laparoscopic even you have open, because your recovery is gonna be better, and your possibility of hernias is gonna be less too.
So again, back to the pre-op tests, and so we recommend that you do the pre-op test, like blood test, if you have access to it before you come, especially if you have had previous bariatric surgery. A lot of the previous bypass patients, they have like low hemoglobin. You want to know that before you arrive, you know, because that puts everything on hold. So also, you know, if you can do PCR, do it, you know. So as much as you can do, again, is not required, but is a great idea to do. Okay.
And I don't have any problem if some patients have a lapse of the last lapse in the last month. If the patients send me the labs, I could review it.
Yes.
And it's better for us to have a background about the patient, even though we are going to make the lab test before the surgery.
Yeah.
But it's important to us to have a background of the patient too.
Yeah. Yeah, we do our own tests, but we do recommend that you do it if you can. Okay. Like another person is asking, should I do CT scan at home? Yeah, if you have access to it, if your insurance covers it, or you can get it done, yeah, sure, get it done, because you know what's happening in your lungs. You want to know what condition you are. You want to make sure that you are going to have less and less chance of a complication. Yeah, even with vaccination, it's a great idea to do PCR test before you come. Another patient is asking, I've had few laparoscopic abdominal surgery. Is that an issue? Had my gallbladder out and had a hysterectomy.
There's no problem with that. If you have that surgeries with laparoscopic approach, you are going to have a scar tissue, but it's gonna be less than if you have the open surgery. Even though if you have a hysterectomy or gallbladder removal open, we could make the bariatric surgery without problem. The only thing is going to take a little more time in the operating room because of the scar tissue, but we don't have any problem.
They're asking how to minimize loose skin after the bariatric surgery.
I don't hear you.
How do they make sure they have less loose skin after?
Okay. It's the thing that I told you before. If you follow the nutrimental instructions, you are going to lose a quality weight. Why? Because the surgery by itself is going to be its work by itself, the surgery. But if you follow the nutrimental instructions, it's going to be more successful. The surgery is going to be more successful, and your skin is gonna lose. You're gonna lose less skin if you follow the nutrimental instructions, because your lose weight is gonna be more fat tissue than muscle tissue. That's why it's important to follow the instructions that we give you and begin with the exercise early after surgery.
Another patient is taking MTHFR, which is methylene. You're familiar with MTHFR?
Is for what disease?
Is an enzyme in the.
Oh, let me check, because it's different. Which is the MTH?
H. Is it the FR or
MTH?
No, FR.
MTHFR. FR. Let me check. For what disease is taken?
Let's see.
Okay. Let me check. Okay, I got it. Okay. And what is the concern?
Is that a problem for going through surgery?
No, and he doesn't have to stop the medication. He have to keep taking the medication and bring the medication with him.
Yeah.
And we're going to begin as soon as we begin with clear liquids. We are going to begin with his medication. Okay. There's no problem.
So another person asked, do they need to stop birth control before surgery? Birth control pills.
If the patient could, it's preferred to stop that medication before 2 weeks before surgery. Why? Because increase the risk of bleeding. That's why we prefer that the patient stop. If the patient has a special issue about and can't stop, we could make the surgery, but we maybe put some medications that help to to coagulate better at the surgery. But if the patient could stop, it's preferred to do it.